ready to do the CVS. Hi you guys, thank you for joining me for another video today. Welcome back if you've been here before. As you can probably guess by the title, I'm going to be talking about my CVS procedure, or Chorionic Villus Sampling Procedure, I had done yesterday during my 11th week and 2 days of being pregnant. Typically you can get a CVS done between the weeks of 10 and 13. I'm going to talk a little bit today about why I decided to get a CVS, why it was needed, and what the experience was overall like. So if you are new here, we have 6-year-old twin boys, and when one of them, Carter, was almost 5 months of age, he was found to have a grade 3 brain tumor that turned out to be cancerous. It's called choroid plexus carcinoma. And typically with these kinds of tumors, there is a genetic component linked to maybe why these are caused or how they happen in children. After the tumor was discovered, we decided to get genetic testing done for Carter, Christian, myself, and Dad. It's a little heavy still to talk about even 6 years later. So we decided to get genetic testing done, and it was found that Christian, Carter, and I all carry a genetic mutation called TP53, or Li-Fraumeni syndrome, and that basically increases the risk of us getting cancer in our life. It's a cancer predisposition mutation, so the risks are much higher in childhood. And for me, being a young adult, 26, my greatest risk right now is breast cancer. So we are very diligent about our testing. We all get MRIs, blood work, all of that stuff annually and every 3 months as needed. I'm out of breath, you guys. After the genetic syndrome was discovered, Christopher does not have it. I am the carrier for it. We decided to be proactive in this pregnancy and do whatever testing we needed to be done for us to have peace of mind. It is not a required test. You do not have to choose to get this done. It's a completely personal choice. It's whatever you think is the best decision for your family. After discussing it, we decided that this is the best option for our family moving forward with this new life. Part of the reason why I wanted to make this video is because after I found out I was pregnant and I knew that there was testing that was going to need to be done, I tried to find videos of women getting CVS testing done, and there was barely anything out there. So I wanted to make a video of our journey because it is pretty unique. We have a lot of different layers to it, and now adding a new layer and a new life, I just hope that I'm able to help somebody out there who might be in a similar situation. Again, we are looking for the genetic makeup of this child to see if this baby also shares the Li-Fraumeni syndrome that Carter, Christian, and myself have. That was passed from me unknowingly, and we feel the more that we know, maybe the more we can prevent. A CVS test takes pieces of the placenta and tests them. CVS can give you answers about a specific genetic syndrome or genetic mutation that is maybe in your family, cystic fibrosis or Down syndrome, just any specific disease that runs in your family. Also with the CVS test, we are getting a test for any chromosome abnormalities. We will know the gender. It will take a few weeks for those results to come back. It's worth it to us. They put me in a room and gave me an ultrasound transvaginally first, just to make sure everything looked fine. The position of the baby, you have to see what position your placenta is in. I have an anterior placenta right now, which means the placenta is just on the front of my uterus instead of the back. With me having an anterior placenta, the doctor told me during the CVS procedure I was going to be able to do it transabdominally. So the needle that they use would just go through my stomach. Sometimes, depending on the placement of your uterus, you might have to do it transvaginally or transcervically, where they go through your vagina, through your cervix, up to your uterus and take the sample that way. If you opt to do a CVS or an amniocentesis, that was my other option, there is a very small risk of miscarriage. Obviously, speak about all of these things, ask these questions before you decide to get any procedures done, know what the risks and what the benefits are, all of that good stuff. So first things first is the nurse is looking at the baby, making sure the placenta's up on the screen so the doctor knows exactly where to go. the doctor gives you a shot of lidocaine in your stomach, which is a numbing agent. I did feel a really, really weird sensation when the doctor numbed me. The needle stung a tiny bit, but the actual numbing felt like my stomach dropped from the outside. Too scared to look at the needle because I knew it was going to be really long. Like I said, I tried to find videos and Google information about a CVS procedure, and I definitely saw very long needles, and I was really nervous. I did not want to look. The doctor let me know before he poked me. So he said needle going in, felt it, so it was definitely about like this long, and they poke you through the first layer of your fat. He does another 2 jabs to get down into your uterus and down into the placenta. It's a very uncomfortable feeling. It's a lot of pressure. It just feels unnatural. Like no one is supposed to be going inside of your pregnant uterus. After he gets in where he needs to be, and then they attach a tube, a syringe, on top of the needle, and he does this, like a sucking motion, and he starts to pull out bits of the placenta. I feel him finishing up with the syringe, and he says, okay, needle coming out. And I felt the needle go through every layer of my stomach. And then he says, I have to do it again. And I was like, I'm sorry, what? Basically, because we're having so many extensive tests, he did not get enough placenta for the amount of testing that needs to be done. He said if this was a normal CVS and we were just doing the basic tests, he would have gotten enough placenta. So lo and behold, he does the entire process over again. Needle go in, I felt the needle go out, no pain, but a lot of weird pressure. So then he was done. He told me about all the risks, what to look out for, you know, take it easy if there's any fevers or bleeding. Bleeding to a certain extent is normal. I'm not going to go into all the details because I'm not a doctor. Your doctor will have to tell you the specifics in your own situation. A little bit of cramping, but nothing severe, no bleeding. Is being sent off for all kinds of analysis. We will be in the know of what to expect for our little one. I'm happy I did it. I'm happy it's over. I will show you guys my little battle wounds that I have. And I'll also show you a picture of my little jelly bean. Okay. So these are my 2 needle marks from the actual amnio, that with a big long needle. And then this one is from just the lidocaine needle. Tiny little wounds for a very important procedure and a very big procedure that will give you so many answers. And now, the little jelly bean. I was able to FaceTime Chris during the ultrasound before the doctor started, so that was really nice. He wasn't allowed to go in the room with me. This is the little baby's belly and legs and little feet. That was just a bottom half shot because the baby's knees were up and it was really cute. Okay, so that is it for my CVS video today. I hope that I was able to help somebody out there who might be looking for answers or insight like I was. We have a lot of new stuff coming to this channel now with this baby, and I hope to see you guys in my next video.